Welcome to the Health Smart Virginia training video, Youth Data, Mental Health, and Substance Abuse. We're going to cover ACEs, mental health, gambling, tobacco and nicotine, underage drinking, marijuana, and opioids. Adverse childhood experiences. Traumatic childhood adversity is often a precursor to mental health issues later in life. In Virginia, most children experience ACEs connected to their household stability. There are other adverse experiences related to community stability, being a victim or witness of violence, bullying or racism, for example, economic stability, having trouble covering the basics. But the most frequent adverse experiences are related to household stability, divorce or separation, mental illness, alcohol, drug abuse, incarcerated parents, witnessing violence in the home or experiencing violence in the home, and the death of a parent, to name a few. The accumulation of multiple adverse childhood experiences is associated with a detrimental long-term impact on health and development. 41% of children in Virginia have at least one ACE, 19% have experienced 2 or more, and 11% have experienced 3 or more. The burden of ACEs is disproportionately borne by children who are Black and Latino. The impact of ACEs can, however, be buffered by supportive family relationships and community interventions, including school-based relationships and interventions. Mental health. Among adolescents aged 12 to 17, 17% had experienced a major depressive episode in the past year, and 12% had a major depressive episode with severe impairment. Among adolescents, those with a past year major depressive episode were much more likely than adolescents without a past year major depressive episode to be a past year illicit drug user or a past year marijuana user. So you can see the incredible differences with those adolescents with the major depressive episode, where 28.6% of them reported past year illicit drug use, and 10.7% of those that didn't reported past year illicit drug use. And then among adolescents with a major depressive episode, 22% reported past year marijuana use compared to 7.9% of those that did not. So as you can see, adolescents with mental health issues are more likely to binge alcohol or use illicit drugs, marijuana, tobacco, or vape nicotine. Mental health. When we look at the national data on suicide, about 5% of people ages 19 or older had serious thoughts of suicide. And among young adults 18 to 25, 11.3% had serious thoughts of suicide, 4% had made a plan, and almost 2% attempted suicide. That's 627,000 people. Concerningly, when we look at adolescents 12 to 17, 12% or 3 million had serious thoughts about suicide. 5.3% or 1.3 million made a plan, and 2.5 or 629,999 attempted suicide. Looking at Virginia data of females, you can see that teens, female girls, ages 10 to 19 account for 51.3% of all female deaths by suicide. And males, boys, and teenagers ages 10 to 19 accounted for 27.5% of all deaths by suicide by males in Virginia. This was from the 2019 Office of Chief Medical Examiner annual report. When we look at the state data presented through the High School Youth Risk Behavior Survey done by CDC across the country, including high schools in Virginia, we see that 32.4% of teens felt sad or hopeless almost every day for 2 weeks in a row, so sad that they stopped doing their usual activities. 16% seriously considered attempting suicide during the 12 months prior to the survey, and 11.9%, forgive the typo, made a plan, and 7% attempted suicide. Gambling. There's a myth that adolescents can't develop gambling problems, but past national prevalence studies have found higher rates of gambling problems among adolescents than in the adult population. Anywhere from 2% to 7% of young people experience a gambling disorder. However, currently there is no available data on youth problem gambling in Virginia, although efforts are underway to gain this data. Tobacco or nicotine use. National trends. The rate of nicotine vaping increases as teens advance through high school. So we know that in 2020, 34.5% of 12th graders and 30.7% of 10th graders and 16.5% of 8th graders reported vaping within the past 12 months. Approximately 1/5 of young adults vape. Nicotine vaping is more common among college youth than non-college youth. When we look at state data from the 2019 Virginia Youth Survey, it shows 2019 as a year that both cigarette usage and vaping increased among middle and high school teens. So 8.9% of teens reported using a cigarette in the last 30 days, and almost 20% of teens reported vaping at least one day during the last 30 days. So that's 1 out of every 5 teens. 5.5% of high school students reported smoking cigarettes within the past month, and 20% reported using electronic vapor products within the last month on the CDC Virginia High School Youth Risk Behavior Survey conducted in 2019. Underage drinking. When we look at national trends in alcohol, in 2020, 20.5%, or 1 out of every 5 8th graders, 40.7% of 10th graders, and 55.3% of 12th graders, more than half, reported using alcohol within the past year. As alarming as this may be, underage drinking prevention was working because the 2020 rates were a significant reduction from 2010 reports of 29.3% of 8th graders, 52.1% of 10th graders, and a whopping terrible 65.2% of 12th graders reporting using alcohol within the past year. Still unfolding are the impacts on youth alcohol use of the COVID-19 pandemic that began in 2020. Excessive drinking does occur frequently among youth. While there was a gradual decline in alcohol use between 2010 and 2020, 16.8% of 12th graders, 9.6% of 10th graders, and 4.6% of 8th graders binge drink. In the context of this data, binge drinking reports to the youth referring to consuming 5 or more drinks in a row at some time within the past 2 weeks. When we look further at trends in Virginia, data in Virginia on alcohol use, 1 out of 5, over 25% of high school students drank alcohol on at least one day in the past month, and 1 out of 8, about 12.7% of high school students engaged in binge drinking during the past month. We know through national research that the COVID-19 pandemic has contributed to reported increases in alcohol and drug use. We've got about 15.4% of those 12 and older perceiving that they drank a little more or much more than they did previously, and 10.3% perceived that they used drugs a little much more or much more as a result of COVID. Marijuana. 1 out of 5 people aged 12 or older in the US engaged in past year illicit drug use, with 84% of those reporting using marijuana. 17% of Virginia high school students currently use marijuana. This according to the High School Youth Risk Behavior Survey done in Virginia of 9th to 12th graders. When we look at monitoring the future data from the National Institute on Drug Abuse, We also see that the percentage of teens who vape marijuana in the past 12 months increased slightly between 2019 and 2020 after a market increase from 2017. And the data, as you can see, shows that in 2020, 8.1% of 8th graders, 19.1% of 10th graders, and 22.1% of 12th graders reported that they vaped marijuana in the past 12 months. The percentage of 10th graders reporting daily or near daily marijuana vaping decreased significantly between 2019 and 2020. Less than 1% of 8th graders, 1.7% of 10th graders, and 2.5% of 12th graders report daily or near daily vaping of marijuana in 2020 compared to lower numbers in 2019. Continuing to consider 2020 Monitoring the Future survey data, 35% of 12th graders, 28% of 10th graders, and 11.4% of 8th graders reported having used marijuana in the past year. This is in comparison to 6.9% of 12th graders, 4.4% of 10th graders, and 1.1% of 8th graders who use marijuana on a daily basis. So as we can see from this, there is an increasing usage across the highest level of middle school through high school. So this presents us with known opportunities for really intervening and preventing use early in middle school. And if we can do a better job at that, maybe we can make a dent in this trajectory. Opioids. So continuing to look at national trends out of the key substance use and mental health indicators in the US 2020 National Survey on Drug Use and Health report, what we see is that in 2020, 902,000 people 12 years of age or older reported using heroin, and 9.3 million reported misusing prescription pain relievers within the past 12 months. So heroin is the number at the bottom of the chart, 902,000. We can see from this chart that prescription pain relievers were the second most used drug among those reporting illicit drug use within the past 12 months. And second only to marijuana is the drug that is mostly reported by people as a drug that they have used within the past 12 months. And we know that exacerbated by the COVID-19 pandemic, opioid deaths in the US have escalated to historic proportions, and adult use of opioids and the availability of opioids pose a great risk to youth. While 49,860 deaths were reported in the National Vital Statistics System for the entire 12 months of 2019. The number of deaths more than doubled in the 12-month period ending in April 2021. So a huge escalation. And this is an image of the country and really reflects the tremendous increase in past 12-month opioid overdose deaths in Virginia. So drug overdose deaths in Virginia increased by 35.5% between 2020 and 2021. So again, huge risks for youth because all drug overdoses were increasing, as well as youth overdoses. So in conclusion, from this sort of data roundup, what we're seeing is that poor mental health and substance misuse continue to be problematic for youth. We cannot ignore this risk to youth, especially because this is a time when there's increased social acceptability around alcohol, marijuana, and other drug use. And we've put together this training video for educators because we want to reiterate that school-based prevention education is critical for ensuring young people maximize their health and well-being potential. So we've come to the end of this training video. We want to encourage you to look at healthsmartva.org for additional information, articles, and instructional resources for K-10 health education to meet the Virginia standards of learning to improve the mental health and prevent substance misuse among the youth.